Thank you very much for the very kind introduction, Mr. Chair. And I know it has been a very, very long day. I hope that you will bear with my presentation. Okay, I'll be presenting my paper titled Assessment of Exposure to Carcinogens Among the Work Community in Manufacturing Sector, a Malaysian Study. So always when I present, people get confused whether I'm talking about the risk of occupational cancer and so on, but I'm not going to talk about that. My study is about risk of occupational exposure to carcinogens within the workplace, specifically at the manufacturing sector. I'd like to acknowledge my principal supervisors, Dr. Marzuki Ishaq and Professor Nirmala Bupati from the Department of Social and Preventive Medicine, University of Malaya. This study is also the original idea and work of Prof. Lin Frischie from School of Public Health, Curtin University, Australia, and we continued the study in Malaysia. The first for this region, for Southeast Asian region specifically, and also first for Malaysia. It was also conducted in collaboration with the Social Security Organisation, consulted by Dr. Azlan Darus. The study is funded by research grants from University of Malaya. Ethical approval was obtained from Medical Ethics Committee, University of Malaya Medical Centre, and the study is registered with the National Medical Research Register under the Ministry of Health, Malaysia. So I'd like to throw two important definitions first. One, about carcinogens first. Carcinogens are defined as substance, radionuclide or radiation that act as agent directly involved in causing cancer. Next, occupational cancer. It is defined as cancer that is caused wholly or partly by exposure to a carcinogen at work, determined by exposure to high-risk substances at work, and type of work performed. Now, this definition is important because a lot of the way that I use the study instrument focuses about the type of work being performed by the employees. A bit about the study background. In Malaysia, cancer is the 9th principal cause for hospitalization and also the 3rd principal cause of death. Between the period of 2007 to 2011, more than 100,000 cases of new cancer cases were diagnosed, mostly among the females. But when we look about occupational cancer cases, there were only 4 cases reported to the authorities and 16 cases compensated between the period of 2013 and 2015. Why these statistics differ, 4 cases reported and 16 cases compensated, is because the reporting mechanism goes to 2 different organizations. Workers in Malaysia also compulsorily registered with the Social Security Organisation if they work in the private sector and earn more than 3,000 per month. So they also collect some data regarding occupational diseases and occupational accidents. So any worker who wants compensation technically will go through the Social Security Organisation, or what we call as SOCSO, for compensation purposes. Whereas for enforcement purposes, not many people will come forward, especially in middle income countries and developing countries. Another interesting fact, we look at a global fact, only 5% of global resources for cancers are spent in developing countries. This also includes any research or development work in terms of preventing occurrence of cancer. Next, about the manufacturing sector in Malaysia. We have more than 40,000, or to be specific, 42,024 registered manufacturing establishments in Malaysia, out of which 90% are within the small and medium enterprises category. It is the largest employment sector, employs more than 2 million workers. Largest economic sector, gross output value was more than 1,000 billion in 2014 itself. And the highest contributing subsectors are petroleum, chemical, rubber and plastic product sector. And from our general knowledge, we do know that these particular subsectors do use a lot of chemicals and mostly are carcinogenic materials. Manufacturing sector is also the sector that recorded the highest number of occupational disease cases reported and claimed for compensation, and estimates from the enforcement agency shows that 75% of manufacturing employees are exposed to occupational hazards, either chemical, noise, ergonomics and so on. So why we decided to carry on this study? Number one, there were existing knowledge gaps in assessment process for occupational exposure to carcinogens in Malaysia. For example, what are the best method to do risk assessment? which particular group we are going to target the risk assessment process. And if we look at previous studies, they were more focusing on the toxicological aspects of it. Like for example, specific chemicals, specific industrial sectors, and so on. But there was no big scale risk assessment studies that was conducted previously. There's also a lack of comprehensive national estimates on occupational carcinogenic exposures. We do not know much about prevalence of exposure to carcinogens in Malaysia. Next, we also do not have the characteristics of exposure within the work groups. So we decided to target the manufacturing sector for the reasons that I mentioned earlier. And we hope the findings of this study will supplement the policy development process in terms of limiting use of carcinogenic substances and also in any preventive efforts done in future. So my research objective, the general one, is to assess occupational exposure to carcinogenic agents among employees in selected manufacturing sectors. We wanted to develop and validate the Malay version of job-specific modules, I will be explaining in detail in a while, for estimation of this occupational exposure to carcinogenic agents. We wanted to determine the prevalence of exposure and also the factors associated with these particular exposures. Research methodology. My study is a cross-sectional study among employees in selected manufacturing sectors in Malaysia. The sampling frame was from the list of manufacturing employees from the Health Screening Program database of Social Security Organisation of Malaysia. Now, what happened in Malaysia was in the year 2015, a new program was established in Malaysia, was approved by the government of Malaysia, whereby any private employees aged more than 40 years old who are registered with SOCSO will be given a free one-time voucher to go for medical screening process. And this details the medical results and their socio-demographic results, including their personal telephone numbers, were collected and put into a database. So this database happens to be the most latest and most comprehensive national database that had details of more than 400,000 employees, and out of which 100,000 plus were manufacturing employees. I required to have the particular latest personal telephone numbers of these employees to make my calls, because my data collection method was actually a computer assisted telephone interview. So I randomly selected 1,291 respondents and used a study instrument known as OC-IDEAS. The Malay version of OC-IDEAS was used, to be precise. I'll be also explaining on this in a while. OC-IDEAS is known as Occupational Integrated Database on Exposure Assessment System, and the study period was 3 years, but I'm in my final year of doctorate, so I hope to be completing the thesis submission soon. So we studied 39 carcinogenic agents, and it's from the priority list of carcinogens known to be present within occupational sectors. They are categorized as combustion products, inorganic dust, organic dust, metals, industrial chemicals mainly, oils, pesticides, solvents. Now, in detail about OC-IDEAS, the study instrument that I use, what is so special about OC-IDEAS? Why is it very interesting? Why I decided to use OC-IDEAS instead of other study instruments for my research project? Okay, first, before that, we need to know what are the other risk assessment tools that were available and what were the shortcomings of or limitations of these particular tools before I speak about OC-IDEAS. First, I can choose to do my measurements to a direct exposure assessment. This is actually the gold standard, meaning I go to each and every factory, do a direct exposure monitoring, and so on for hours, leave the tool, or do a ad hoc sampling and so on to get the results. But this is a very costly method, and you need a lot of permission to access factories because these are private entities. Permission to enter will not be given easily. We might need collaboration with enforcement agencies and so on. A lot of paperwork, not suitable for a doctoral project, and extremely time consuming. How about job exposure matrices? We plot the risk of exposure based on the frequency and severity of exposure, but the disadvantage of job exposure matrix is that it uses the job title, meaning we look at a big job title, for example, doctor, nurse. We are not looking at whether the doctor is doing anesthesia work, pediatric work, and so on, to be specific. So it applies to the manufacturing sector because they do different tasks and job processes. How about self-reported method? Meaning I give one specific questionnaire to the employees, ask them to fill up and give it back to me. Possible, but they might not be aware about the extent of exposure, and it's a very specific set, and there can be recall bias, meaning those who are aging or towards the retirement age or might be having some discomfort or shortcomings within the workplace might be complaining or reporting things in a biased manner. Next, how about manual expert assessment, meaning that as experts go into the sites, do a very detailed assessment about the job tasks and so on. It can be done, but you need many experts to do the process. Also time consuming, will lead to expert burnout, and ultimately the results won't be that convenient or consistent, and it's very labor intensive. Now, these are the shortcomings of existing tools. Then what is so good about Org Ideas, this new tool? Now, Org Ideas is a web-based automated expert assessment system. It assesses each and every job task or job process specifically. It's based on the expert's experience, meaning it's developed by a team of experts based on their knowledge, existing literatures, job history of the employees, and also known exposure measurement records. So it was a semi-quantitative comparison. Assessment is done in a more transparent and consistent manner, meaning it can be reproduced, adapted by a different country, and so on. It is time-saving. It has 26 job-specific modules. There are 37 fragment lists within the system, meaning each and every respondent will be answering different combination of these modules. So there can be many types of combinations, and to our surprise, some of these combinations were not even tested in the earlier study that was conducted in Australia, because our manufacturing sector in Malaysia totally differs from the manufacturing sectors or work sectors that were available in Australia. So meaning that for every job task and job processes that the employee does, they will be answering a specific set of modules. Can be 5, can be 6, some even went up to 10, and so on. And in the process, they will be assessed for exposure to 39 carcinogenic agents, the priority carcinogenic agents that I mentioned earlier. So how does this Org Ideas work? It is installed as a web-based application. So the assessment process is automatized, and priority carcinogens are listed and already logged in the system. Through specific rules for exposure assignment, we assess the probability, level, and frequency of exposure through predetermined algorithms. Next, a computer-assisted telephone interview is carried out to assess the risk of exposure, and risk is estimated. Now, there can be certain situations where we encounter issues, meaning the system was not sure about the exposure because it can be extremely unique. You would never have expected it, and so on. Then a manual review of exposure is done, again based on my personal experience, consultation process, literature review, and so on. The data is then analyzed and we get a study outcome. And the best part is the system can be improvised, and new exposure assessment system or recommendations can be included to improve further assessment in future. So to fulfill my first objective to develop and validate the Malay version of Org Ideas, we did a validation process. First, expert validation was done for the English version, whereby content validation for all the modules were performed by 9 safety and health experts from various agencies. The modules were commented for its suitability for Malaysian manufacturing sector. Next, the tool was translated from English to Malay by 4 independent translators, also from the safety and health sector and healthcare sector. After that, the Malay version was again expert reviewed by 3 industrial experts. For example, within the petrochemical industry, certain terms like upstream, downstream, and so on have to be retained. We cannot directly Malay translate because it's not applicable, and people within the industry will not comprehend the Malay meaning of these terms. So we maintain those English terms for the respondents and within the modules. And after that, before doing our pilot study, we did something called as test interviews. Now, test interview means we answer yes for each and every question within the modules until the system runs the complete combination of whatever possible. So we did 10 sort of test interview process. It's a self-performing mode. We did not have any real respondents. Why we did that? Because we wanted to assess the technical feasibility and also whether there were any systemic glitches if the real study is run. So response fraction for my study was 51.3% out of 628 contacted respondents. 501 were selected as final sample after primary and secondary exclusions were done. And the results, the background of respondents, majority were male respondents, 59%. Ethnicity-wise, majority are from the Malay ethnicity. And for age group, as I mentioned earlier, my respondents are those from 40 years and above. So if we look at the graph here, the majority of the respondents are within 45 to 59 years old. Mean age was 51.76. Mean BMI was 26.74, which is overweight category. Regarding the education level of respondents, 432 of the respondents are from the with secondary or lesser education backgrounds. Majority also did not have any underlying medical conditions. 19% are smokers and 6% are ex-smokers, which we also consider as smokers. Now, we define exposure as being exposed to at least one carcinogenic agent at either high or medium level. We did not consider low level of exposure as being exposed. Why? Because in our country, having a low level of exposure legally means that control has been performed or initiated to ensure that exposure is as low as reasonably practicable, a term within occupational medicine that we define as allowed. So from our study, we found that 78.8% of the respondents are exposed to at least one carcinogenic agent, and 51.9% are exposed to high level to at least one carcinogenic agent. We did another interesting thing whereby we tried to exclude exposure to ETS or environmental tobacco smoke. Why? Because environmental tobacco smoke exposure is not generated directly from the work task or work process. And we got a new result whereby 69.1% of employees were found to be exposed. And high level of exposure when you exclude ETS is 33.5%. Now, we divided the manufacturing sector into 4 subsectors: production, transport or warehousing, cleaning, recycling as one category, heavy industry or mining as another category. And we interestingly found that actually production sector, if we look at a column-wise statistic, production sector actually the highest level of exposure. Now, specific for each and every chemical, we tried to look at the prevalence of exposure for it. From our study, we found that toluene has the highest prevalence of exposure, 33.1%, followed by diesel engine exhaust, environmental tobacco smoke, benzene, styrene. If you look at the table here, you will realize that I don't have all the 39 chemicals here. I went up to 1.8%, which is for formaldehyde. The rest I never put because they are 1% lower or zero exposure. So these are some of the interesting findings that we had. And if you realize, a lot of solvents had significant exposure as well, high probability of exposure, for example, trichloroethylene, tetrachloroethylene, and so on. Next, we looked at the socio-demographic and occupational characteristics that were associated with exposure to at least one carcinogenic agent. There was significant association noted for sex, ethnicity, and smoking status. Male gender or male sex were found to be at higher risk of exposure with significant findings. Malay and Bumiputra ethnicity were 2.49 times more likely to be exposed as compared to the Indian ethnicity. And surprisingly, non-smokers were also at higher risk of exposure as compared to, or at more likely to be exposed as compared to smokers. And we did another sub-study whereby we looked at environmental tobacco exposure alone. We realized that even non-smokers were also at risk of being exposed to ETS. So that was pretty interesting for us. Next, we look into 7 occupational characteristics associated with exposure. I was hoping for some interesting findings. We looked into income level, total years worked, remoteness of company, industrial status, number of employees, job categories, and occupational groups. Now, those within the second income category earning between Ringgit Malaysia 1,000 to 1,999, they had a higher probability of exposure, but the finding was not significant. Those who worked more than 20 years were more likely to be exposed. Finding was not significant either. Surprisingly, we were expecting those from the rural area to be exposed, but even then, we had a different finding. We found that those from urban area are more likely to be exposed. Although initially I mentioned that 90% of Malaysian factories are within small and medium enterprises, this study showed that multinational companies, employees from the multinational companies, they had a higher probability of exposure as compared to SMEs. Significant finding was noted for textile and printing workers. They were found to be least exposed as compared to support service workers. We ran a multivariable analysis to look into selected predictors associated with occupational exposure to carcinogens. We found that ethnicity, smoking status, and occupational groups were significant predictors of exposure. And Malay and Bumiputra ethnicity, again, they were 2.41 times more likely to be exposed as compared to the Indian ethnicity. Now, to summarize the key findings of this study, it estimated that 78.8% of manufacturing employees in Malaysia are occupationally exposed to at least one carcinogenic agent. 51.9% are occupationally exposed to high level of carcinogenic agent. High prevalence was noted for toluene, diesel, engine exhaust, environmental tobacco smoke, benzene, and styrene. We also found higher probability of exposure to at least one carcinogenic agent for male employees, those from Malay and Bumiputra ethnicity, non-smokers, and production subsector. Occupational group was found to be a significant independent predictor of occupational exposure to carcinogenic agents. So these are some of the key findings that we found for our study. So as conclusion, I would like to say that most importantly, we introduced a very innovative new method or new risk assessment method, to be precise, for large-scale assessment of occupational carcinogen exposure in Malaysia. And it was also first for the region. We found a very high prevalence of occupational exposure to carcinogens. It is even higher compared to the original study that was done in Australia, and this finding is of concern. This is a very novel study for Malaysia. It's a very important addition for scientific literature and can be used to attribute occupational exposure to occurrence of occupational cancer among the population. And finding of this study is suitable to substantiate if any relevant policy is going to be made for implementing preventive actions for occupational exposure to carcinogenic agents in Malaysia. So with that, I thank you.